EP 43, How to Prevent and Relieve Constipation After 60. Constipation is one of the most common digestive complaints in adults over 60, affecting approximately 1 in 3 older adults and becoming more prevalent with each decade. It is uncomfortable, often embarrassing, and frequently dismissed as trivial by both patients and doctors. But chronic constipation is not trivial. It significantly reduces quality of life, causes abdominal pain, bloating, nausea, and appetite loss. Straining at stool raises intra-abdominal pressure in ways that can cause haemorrhoids, anal fissures, and even cardiovascular stress. And in older adults, constipation is associated with delirium, reduced mobility, and medication complications. The good news is that the majority of constipation in older adults responds dramatically to well-evidenced, natural interventions. Today we're covering why it develops and exactly what to do about it. Several age-related changes conspire to slow the bowel. Reduced gut motility. The muscles of the large intestine contract more slowly with age, extending transit time, the time it takes for waste to move from the small intestine to elimination. Average transit time is longer in older adults, meaning stool sits in the colon longer, losing more water and becoming harder and drier. Reduced fluid intake. Thirst sensation diminishes with age. Many older adults are chronically mildly dehydrated, which causes the colon to extract more water from stool, making it harder and more difficult to pass. Reduced physical activity. Movement stimulates bowel motility. A sedentary lifestyle directly contributes to constipation. Low dietary fiber. Many older adults eat diets insufficient in fiber, partly from reduced appetite, partly from reduced variety of foods. Medications. This is a major and underappreciated driver. Opioid pain medications cause severe constipation in virtually everyone who takes them. Other significant contributors include iron supplements, calcium channel blockers, antidepressants, diuretics, antihistamines, and antacids containing aluminium. Pelvic floor dysfunction. Age-related changes in pelvic floor muscles can make the mechanics of defecation difficult. Dietary fiber is the most powerful dietary tool for preventing and treating constipation. Fiber works in 2 ways. Insoluble fiber, found in wheat bran, vegetables, and whole grain cereals, adds bulk to stool and speeds transit through the colon. Soluble fiber, found in oats, legumes, fruits, and psyllium, absorbs water and forms a gel, softening stool. Most older adults consume 10 to 15 grams of fiber daily, well below the recommended 25 to 30 grams. The most effective dietary changes for constipation are increasing vegetables, particularly leafy greens and cruciferous vegetables, increasing legumes, lentils, beans, and chickpeas, switching to whole grain bread, pasta, and cereals, and adding fruit, particularly prunes, kiwifruit, and pears. Prunes deserve special mention. Prunes contain sorbitol, a natural sugar alcohol with a gentle laxative effect, and chlorogenic acid, which stimulates bowel motility. 5 to 10 prunes daily is as effective as supplemental psyllium for constipation. Dried figs and apricots have similar effects. Kiwifruit has strong clinical evidence for improving stool frequency and consistency. 2 kiwifruit daily outperformed psyllium in a randomized trial. Important: increase fiber gradually. A sudden large increase can cause bloating and gas. Add 1 additional fiber source per week while simultaneously increasing fluid intake. Fiber requires water to work. Without adequate hydration, increased fiber can actually worsen constipation by absorbing fluid from the colon. Aim for 6 to 8 glasses of water or fluid daily, more in hot weather or with exercise. Warm water and herbal teas are particularly effective at stimulating bowel motility. A glass of warm water first thing in the morning, before coffee, stimulates the gastrocolic reflex, the natural contraction of the colon triggered by the stomach being filled after overnight fasting. This is why many people have a bowel movement shortly after breakfast. Daily movement. Even a 15 to 20-minute walk after meals significantly stimulates bowel motility. The mechanical effects of walking, abdominal muscle movement, changes in posture, increased blood flow directly accelerate gut transit. Toilet posture. This is underappreciated but important. The human body was designed to defecate in a squat position, which straightens the anorrectal angle and makes passage easier. On a standard Western toilet, placing a footstool under the feet to raise the knees above the level of the hips approximates this position and makes straining significantly less necessary. This is not folk wisdom, it is supported by clinical evidence. Respond to the urge. Repeatedly ignoring the urge to defecate, common when people are busy or away from home, trains the rectum to become less responsive. When the urge arises, respond to it. Routine. The colon is most active in the morning, particularly after breakfast. Allowing time for a toilet visit after breakfast, without rushing, takes advantage of natural bowel rhythms. Psyllium husk is the most evidence-based fiber supplement for constipation. 1 to 2 teaspoons stirred into water or juice once or twice daily, with plenty of fluid, significantly improves stool frequency and consistency. Available cheaply as a bulk powder. Magnesium citrate or oxide acts as an osmotic agent, drawing water into the colon to soften stool. 200 to 400 milligrams at night is effective and gentle for most people, with the added benefit of magnesium's role in sleep and muscle function. For occasional constipation, osmotic laxatives, polyethylene glycol, lactulose, are safe for occasional use. Stimulant laxatives, senna, bisacidil, should be used sparingly and not relied upon regularly as they can cause dependency. Always discuss laxative use with a doctor if constipation is persistent, worsening, or accompanied by blood, unintentional weight loss, or significant pain. Constipation in older adults is common but not inevitable. Fiber, hydration, daily movement, and good toilet habits resolve the majority of cases without medication. Start with the basics: more vegetables and fruit, more water, a daily walk, and a quiet, unhurried moment after breakfast. For most people, these changes alone produce significant improvement within a week or two. If constipation is persistent despite these measures, please speak with your doctor to rule out any underlying cause. See you in the next video.